But listen, the discussion is on this morning.
Yes.
We've got Dr. Darren Green. We're talking about natural versus cesarean birth. And we ask you to call us on 083-913-3728. Get your calls in and ask your questions to the good doctor. Right now, he's hanging out with Ilana.
Yes, definitely. Now, before you even ask your questions, we might be answering some of them already. Earlier I mentioned to Katleho, summer is the month where, or the time that most babies are born worldwide. And it seems like we do have options. I mean, with September now finishing, done and dusted, we're looking at that time where we're bringing up this topic, cesarean versus natural birth. Well, I'm not the expert on it, but we do have an expert, Dr. Darren Green. Welcome to the show.
Morning.
Let me get straight into it. South Africa is one of the countries where we have an option. We can choose between cesarean and natural birth. What are the differences? What are the options for women, especially when it comes to public and also private healthcare?
Yes, I think what's important to know is the term elective cesarean section. That is where the mom actually has a choice as to which procedure she wants to go through. And in South Africa, you can imagine the load in our state system, in our government hospitals. The load is incredible. The option to have an elective cesarean section in state is really minimal due to obviously the risks, the prolonged hospital stay, for example, the risks of anesthetic, and also, obviously, the fact that it's a full-on surgery. There are ever other sides to the story, which I'm sure we'll get into. But in the private sector, we find a growing tendency of a lot of career women, a lot of go-getter, active women to plan their lives, to want and actually opt for cesarean section.
What are the pros and cons? I mean, we assume that natural birth is better for you because the recovery time's better. But I must say, even from the friends that I have, a lot of them are concerned about the long-term damage that you almost give to your body. What are the pros and cons of natural birth?
Sure, 100%. Natural birth has a quicker turnaround time. So an hour after giving birth, for example, you can stand in the shower and shower yourself. Obviously, having a cesarean section has a full-on surgery where you actually go through about 7 layers of the abdomen to get to the uterus, cut through the uterus, and then deliver the baby. The pros of natural birth, obviously, a lot of women feel that there's a bonding that takes place. A lot of people associate pain with bonding too. You get women that are all for natural birth with no pain relief to say afterwards, "Ek het dit gedoen, I made it through without any pain relief." And then you get women as well that are willing to go through natural birth with effective pain relief, either in the form of epidurals, etc. And then obviously the other thing with natural birth that is the environment for the baby specifically, as the baby moves from the uterus through the canal, out extravaginally, for example, that process involves a step-by-step process. It's not an acute, sudden change of environment for the baby. Oops, here come the bright lights, a change in temperature, etc. But as I say, there are pros and cons to both processes.
So what are the pros and cons of a cesarean? I mean, most career women, we want to plan. We want to say, you know, it's happening on the 7th.
Exactly, to plan when you can go back to work, for example, and actually be in the country when your husband's around, etc. as well. We do find that a lot, and I think a lot of private gynaes are faced with that challenge. You know, the pros to cesarean section are you've got to look at the time it takes. Obviously, it's very quick in and out. If you have a complicated birth where the baby's too big, can get stuck in the canal, for example, you have the complications of a prolonged labor. So, you know, what you need is actually a perfect match between the mom and the baby, and each profile is different. You've got to look at the pelvic size. You've got to look at the size of the baby. You've got to advise appropriately after doing what they call pelvimetry, where they actually look at the size of your pelvis in different angles, the size of your feet. They always say a size 3 foot, for example. Must be careful, because it affects the size of the pelvis.
You see, it would have been easier if it was just the women's genes, but there's a guy involved, so you have to look at your husband and go, wow, okay, my baby might look like you. Okay, so from an emotional point of view, I mean, I want to talk about baby's development. You spoke about the journey through the canal and how, you know, the baby gets used to everything. Take me through that, the actual baby's development and character. Is it different to a natural birth and cesarean? Do you get different babies if it was, let's say, the same baby with a different birthing process?
Yeah, studies have been done that reflect that the birth process, it does affect certainly the psychological and emotional condition of a baby, and it certainly can. Things like, for example, preterm babies that are fighter babies that have to fight to survive.
Speaking of survival,
Yes.
diseases, I mean, are cesarean babies more prone to diseases than natural birth babies?
There are studies that show that the immune system is better modulated in babies that are born through natural birth
Right.
first because of the exposure to the commensal bacteria that line the tract as they exit, for example. But there are various theories on which specific bacteria, what we call the hypothesis of hygiene, or the hygiene hypothesis.
Okay, well, I have a lot of questions about this. Dr. Darren Green in our studio. This is a Feel Good Breakfast show, which means we want to make you feel good at home. If you are unsure of anything, well, we've got the expert here, 08391333728. We'd love to answer your questions. If you just joined us, we're talking about exciting stuff, how we all got into this world in the first place. Cesarean versus natural birth. 08391333728. The number's also on screen if you want to give us a call. Dr. Darren Green is going to stay with us. In fact, there's loads more happening on this show. Katlego, Mabue, what you got?